Hi, man. How are you?
I'm doing very good, thank you.
I have a few questions for you. First, you just went through a list of your credentials. Can you tell me about your scientific background again?
Well, I've been a practicing naturopathic physician in Portland for the past 30 years. I was an assistant professor of pharmacognosy, which includes toxicology. I was the lead author of my National Association's paper on heavy metal toxicity. At Grant, I was American Chemistry Student of the Year, so I believe I have a fairly good ability to comprehend the scientific discussions that are going on. I'm also an ordained pastor with a non-denominational Christian church and a member of First Unitarian Church where this event is taking place.
Well, thank you. And your name is?
Stephan Bailey.
Stephen Bailey. Nice to meet you.
Thank you. Nice to meet you.
And I have a question because I'm very passionate about my organic garden. I go out of my way to not use pesticides. I use things like lemon juice, or diatomaceous earth to get rid of the pest in my garden. And I'm very concerned because I'm not a scientist. I've read that fluoride is a bioaccumulative, and I believe it stores in my body. But what does that do to my garden? If I'm forced to spray fluoride on my garden, what's that going to do to my plants?
Probably not anything that's visible, because this is a low-grade, slow, continual process, and that's where the debate has been so soured with this whole process, because the proponents continue to argue against non-submitted arguments that deal with the public not understanding the difference between acute toxicity and slow genetic and physiologic changes that happen when things accumulate in an everly worsening state of health in our society, because almost every neurologic disease and cancer has ballooned and skyrocketed over the last 50 years. So we are much weaker. But your organic garden, you will get a slow accumulation of additional fluorides and whatever smaller levels of toxic chemicals are in there. And that is not a pure organic system. But you will find that the USDA, left unhaltered, will add anything they want to their definition of what is a fluoride or what is a contaminant to the organic determination.
Right, yeah.
So we fought for decades about real, true organic labeling, and to me, the only assured organic is a farmer I know or my own garden. So yes, it does begin to stain the purity of your foods.
Thank you. Now, I hear a lot about, from the proponents of fluoride, well, let's just emote a little bit louder, okay, because of those ladies.
Yeah.
I hear a lot from the
proponents.
I hear a lot from the proponents of fluoride that, it's only a small parts per million. It's only a little tiny amount that we're ingesting, like 0.7%. Can you explain me the difference between concentration and dose level and why that's important?
Well, that was a point made at the hearing by the past president of the American Cancer Association in Oregon. And he was pointing out that in pharmacology, you look for the safe dose and then you multiply that number by 10 to establish what can be more broadly safe. But that's old Newtonian science. That doesn't even stand up. That would be the least appropriate limitations, which would be 0.07 or 0.01. At worst, 0.04, which is their upper limit of 4 parts, where they say disease is starting to become more of a concern, or the level is more of a concern. But realize that fluoride has absolutely no normal biologic activity in humans or animals. It attaches to the dentum almost exclusively from topical application, and the research says that what goes into the body, our medical school texts say, cannot go back up through the pulp of the tea to get to the teeth to get to the dentum. So this is not how you fluoridate, but it has been found that when fluoride attaches into the teeth, that bacterium can't thrive. So it is a bacteriostatic or a bactericidal halide that has no part in the human body. And by preventing 1 in 4 cavities in poor, undernourished children, which will develop diabetes, heart disease, and cancer, you are not finding a healthy society, but you are minimizing your attempt to improve the plight of the social economic poverty that is rampant within our world. It is clear that the studies that showed hard water has fewer cavities had hard water that had magnesium, selenium, chromium, calcium, other natural nutrients that help bone and teeth formation. But it's just like the Okinawan studies. Okinawans live a long time. Some nation bombed them into almost the Stone Ages, and they were fed Spam. And years ago, Spam proved that the per capita intake of Spam, just looking at Okinawans, provided the longest life in human expectancy. It is an unconclusive statistical consistency based not on true science, but on the ability for statistics to find a reliable answer. And that is the smoke and mirrors that's existing in this very dastardly attempt to alleviate health and human responsibility to the uranium, the nuclear, and the aluminum industries. But what is most important, and why why I wear my collar for these discussions and hearings, is because this is a moral imperative. Science has evolved tremendously in the last 15 years, and we can look down at the very tiniest level of genetic perturbations, which means changes. Whenever I start talking science to the public, they tell me they hear white noise, and yet I hear these commissioners tell them they understand the science, and they cannot understand these words, so I'll try to stay simple. We have a type of science called epigenetics, which has recognized profoundly at the international scientific community that very small factors can profoundly harm the health of people because of different genetic susceptibilities or probabilities. Portland is the last urban center with multi-diverse cultures for which science could now take a controlled study and definitively prove the risks of fluoride. And now that people are coming to this wonderful hearing, it's getting louder, so maybe I'll get another time to talk with you. I thank you so much for this opportunity.
Thank you.